What do you have? What's the new toy you got to show me?
Well, you know how whenever I figure something out health-wise or beauty-wise, I like to share it with you all. And I know this is not something absolutely new, but I know a lot of people are just starting to hear about it.
Yeah.
And I heard about it basically for just anti-aging. And of course, that piqued my interest.
A lot of the stuff that you introduced us to is very useful, very efficacious. A lot of the things have made me much healthier.
Well, I just hear about it and then I think I need to do some research on that. So I'll go kind of in depth. I don't know a ton about it, but I knew that I wanted to get one and get started and just see what it would do for me. I talked to a few people who used something like this, and they said that it really evened out their skin tone, and they felt like it was, helping them to create more collagen and elastin. Also, I'd like to say, I'm not a doctor. I'm not telling you to do this. I'm just telling you what I have found and what my research has shown me. So you should do your own research before you start anything new. But this, I have to show you, it's so cool. It is a red light therapy unit. They call it a tower. And it has near infrared light, which is very healing. It goes deep into the body. And then there is just regular red light therapy, which is really good for your mitochondria. It's so good for your skin. It can help with acne. The near infrared can help with cognitive issues. It can help regrow hair. Like it will actually heal the hair follicles. It will help with wrinkles. Like I said, it'll get rid of dark spots, and it'll help actually pick up tissues that have drooped.
Wow.
So droopy skin. I know I have a lot of customers that say, I hate this, or like I hate my arms, they're all wrinkly and stuff. And
Customers for
spray tanning.
Spray tanning.
Like customers for spray tanning. But yeah, so I've started telling people you might want to look into this. So whenever I use it, I use the near infrared and the red light therapy. They say that you should use it for say 2 12-minute sessions a day. And the first session, maybe, you use it kind of far away like this, so that it's getting your whole body. So maybe not that far, but probably like 2 feet. So you get your whole body, so you're getting like a full body dose of the red light. And it doesn't hurt your eyes. It's actually good for your eyes. Some people don't like it in their eyes because it's very bright. Once you do a session, it's hard to see. Like if you go to put your makeup on or something, it's like, whoa, I cannot see. So you have to wait for like a minute or two. But I am very excited about this. I think there are so many things that it can help. I've even
too many to list, right?
Pardon?
Probably too many to list.
So many, like eczema,
Benefits.
psoriasis, pain relief. So I had hurt my knee, and I wish that I had had that, because it took 6 months of chiropractor and just babying it, and it took forever to heal. And I think that if I had had something like this, it would have healed much more.
And what were you going to say when I interrupt you?
I was going to say that it can heal wounds very quickly, and they say that if you put some coconut oil or honey on the wound and then do the sessions, and you only need to do like a couple a day, like 5 minutes a day or 10 minutes a day, 2 5-minute sessions. It will heal it in no time.
All right. Again, you said you're not a doctor, you're not a therapist.
Right.
This is just anecdotal stuff you have heard, but you keep hearing it over and over and over.
It also helps your mitochondria to produce ATP, which helps with exercise. It also helps with sports recovery, so your muscles don't get as sore as they would, and you can work out longer and harder. And I have noticed that.
Well,
I do feel a lot better in my
as
workouts.
long as it's one of those things that the medical industrial complex doesn't like, put me
Well,
down for one.
They're not going to like it because it's not that expensive.
Yeah.
You can get smaller ones for so cheap. And they're basically low light emitting lasers. That's what they call them. They're basically lasers, but they have no, as far as everybody knows so far, they have no negative side effects. So it's amazing to me. Like, I'm so excited about this. I think it's going to help a lot of people.
Would you be willing to sell this one if you ended up getting another one to one of your followers?
Sure.
Okay. Because I know you're probably going to get even a bigger one.
Yeah, and also I'd like everyone to know that I didn't receive this for free. I'm not getting a kickback. I don't even think this one is a brand.
To be honest, you will now because you're basically touting.
I would like to find a really nice one. I have found one like that's tall, like that you could just put it on the wall and it gets your whole body at once. You can stand as close to it as you want.
But you're really touting the virtues because of your own passion, not because this is some commercial thing.
Exactly.
Yeah.
Exactly.
So, and as always, you like to share. Your last thing was DMSO, and you don't sell DMSO.
That's true.
Sodium methyl. Dimethyl.
Dimethyl sulfoxide.
Okay.
Also, look that up. That's pretty amazing. I got rid of a skin cancer that was pretty big right here.
And look up.
Gone.
Look up hydrogen peroxide, and you can't even say what you do with it.
Hydrogen peroxide therapy. Yeah.
You can't even say what you do with it. Can you?
There are many ways to
heal your body.
Yes.
And many other things that they have told us all our lives are lies. So we're not even going to tell you what we do with the hydrogen peroxide. But supposedly it will kill you, and it hasn't killed us.
There is a book called The 1 Minute Cure. Look that up. And there's also a book on red light therapy by Mark Sloan that goes way in depth on what this can do for you. So
what you do
research.
Is you with this you need a hanging device for it.
You can hang it up on the wall.
And you actually sit on the ground and have it leaning against that wall. And I've seen you many times sitting naked right here, facing it.
Yeah, I put a towel on the ground. But sometimes I'll take it and put it on the bed like this.
And then lay beside it.
Yep, and I just lay on my side.
Okay.
It's comfy. I put a little
Let me see
pillow under my head. Yeah. Oh yeah, I usually do it the opposite way. I do it over there, and then I just lay here. And sometimes
for 20
I keep
minutes.
turning it back on.
20 minutes of this.
Yeah. I do like 15, 20. So it's pretty cool.
Yeah, that's really neat.
I love it. I think it's amazing. I wish I could buy one for all of you.
Yeah, well, people will get the message. So a lot of people don't believe any of this stuff. We're just...
They range from $30 to $2,000. So...
And we've been doing everything physically possible to stay away from medical doctors.
Yes.
Not that they can't. I mean, I go like Robert Kennedy said. I only went to doctors for stitches.
And,
all my life.
Casts.
All my life. I never broke a bone, but I cut myself. I tore and bludgeoned myself many times.
Yes.
Or was bludgeoned.
Yep.
And that's what I went to doctors for. And now I'd like to keep it that way. But as we age, it's harder and harder.
It is.
So.
And I am not trying to say anything disparaging to doctors because I know most of them do have good hearts. Want to heal people, but
some of them,
the way that they're taught, they don't heal.
And they're too incented by money to go with the flow.
You're captured by the medical industry, the pharmaceutical industry, because they're the ones teaching them. They're the ones funding all their.
Yep. And if you make us money and toe the line, we'll give you money and you'll keep your license. No, exactly. Thank you.
Exactly.
That's too conflicted for me. Well, thanks for sharing.
Yeah, thanks for watching.
Anything else?
I think that's it for now.
Oh, yeah. Nice.
I'd like to keep it on all day long every day.
It makes you look weird.
Yeah, I know. I know.
All right.
Well, thanks for watching, everyone. Mwah. Be sure to check the description below for links and more information.